Ugly side effects of drinking too much coffee, according to science. Coffee and tea are incredibly healthy beverages. Most types contain caffeine, a substance that may boost your mood, metabolism, and mental and physical performance. Studies have also shown that it's safe for most people when consumed in low to moderate amounts. How much coffee is considered too much coffee? Surprisingly, you can drink a lot of coffee during the week. It's actually recommended that people stick to no more than 28 cups of coffee a week, which is about 4 cups of coffee a day. For some, 4 cups of coffee may sound like a lot. But if you're one to consume more than 32 ounces of coffee a day or love to down sugary lattes from your local coffee chain, it may be wise to evaluate these ugly side effects you're drinking too much coffee. Because while having a little caffeine can cause a lower risk of death according to the AARP, drinking too much of it can create negative side effects to one's health. Many people claim they can't function without their morning cup of coffee, and we get it. The caffeinated beverage gives us the get up and go we all crave in the morning. And while coffee provides a host of health benefits, such as reducing chronic inflammation in the body, there are a few potential side effects that you should be aware of. Below, you will see 5 such symptoms to be cognizant of after drinking a cup, or 2, or 3, of coffee, especially if you're drinking the beverage for the first time. Here are the ugly side effects to expect if you're drinking too much coffee, according to research. 1. An increase in blood pressure. According to Harvard Medical School, caffeine doesn't usually cause your blood pressure to elevate for prolonged periods of time. The medical research isn't quite clear, as some studies do support a link between coffee and hypertension, high blood pressure, while others don't. For example, in a 2-year study that included over 45,500 men between the ages of 40 and 75, Harvard scientists found no association between cardiovascular disease or stroke, of which high blood pressure is a predictor even in heavy coffee drinkers. However, a 2015 study indicates that those who don't drink coffee regularly could experience a short-term increase in systolic blood pressure after drinking espresso. Bottom line, the research is inconclusive and it largely depends on how often you drink coffee as well as what your blood pressure levels are before drinking it. That being said, before going to the doctor for a checkup, you may want to avoid drinking a venti coffee or a cup of espresso as it could temporarily cause your blood pressure to spike. 2. Regular headaches. It's possible that you're drinking too much coffee and it could be the reason you're getting headaches. A study published in the American Journal of Medicine asked nearly 100 people with migraines to record how often they consumed caffeinated beverages. This includes coffee, tea, carbonated beverages, and energy drinks. 3. Elevated anxiety levels. A typical 8-ounce cup of coffee has 95 milligrams of caffeine in it. So if you were to drink over 4 cups of coffee, you would hit around 500 milligrams of caffeine in a day. One study by the Journal of Psychopharmacology reports that being a high consumer of caffeine on this type of level can cause high levels of stress, anxiety, and even depression. The study says that consuming more than 1,000 milligrams of caffeine a week even showed to be a predictor of high anxiety. While anxiety and stress are good things to talk over with a medical professional, especially in terms of your mental health, it's also important to evaluate your caffeine intake with that professional and discuss better caffeine habits moving forward. 4. You're not getting good sleep. Regularly consuming coffee can cause issues with your normal sleep patterns, especially if you're enjoying a pick-me-up cup in the afternoon. One study evaluated 197 high school students. A mixed amount of users with moderate caffeine intake reported early morning awakening and daytime sleepiness compared to a group that drank lower amounts of caffeine. While there are a lot of health benefits to drinking coffee on the regular, keeping your daily coffee intake to a minimum, and in the morning, can help with your sleep patterns at night. 5. You have the jitters. Ever experience the shakes after too many cups of coffee? This can actually be defined as a caffeine overdose, which Healthline states can cause headaches, jitters, difficulty sleeping, and as we already mentioned, an increased heart rate. If you're experiencing any of these severe ugly side effects you're drinking too much coffee, you should seek medical attention. 5. You're feeling fatigued. It's natural to turn to coffee, or other forms of caffeine, when you're feeling tired. But did you know consuming too much caffeine can actually have a negative effect? Especially if it includes added sugars. In a study published by Innovations in Clinical Neuroscience, where participants were given certain amounts of caffeinated beverages for energy, drinking caffeinated beverages, especially with sugar, on a regular basis did cause mental fatigue for participants. While this is common for caffeine to cause decreased energy levels as it wears off, it's best to time it for when you plan on sleeping, instead of turning to more coffee to keep you awake. Because disrupted sleep later will cause even more fatigue throughout the day, creating a vicious cycle. Now that you know how much coffee you can have, here are some advice when drinking coffee. 1. Avoid drowning your coffee with sugar. Have you ever actually looked at the nutrition information of that caramel latte you love to order? If you're ordering a large caramel latte at your favorite coffee shop, you're likely consuming at least 30 grams of sugar at once, sometimes more for shops like Starbucks or Dunkin'. Studies have shown that eating too much sugar can lead to an early death. And no, it's not due to obesity or weight gain, but the fact that sugar can cause dehydration, which can be a symptom of high blood sugar and, if not monitored, a risk of diabetes. Instead of ordering a sugary latte, why not ask for a regular latte with a small caramel swirl on top? You can mix in the caramel and still get that same great taste, but with significantly less sugar. 2. Avoid adding too much creamer. Similar to your sugary latte, if you're not careful with your creamer, your coffee at home will also be drowning in sugar. Choosing to use a half in half or little milk, or even almond milk, would be a better choice than a sugary coffee creamer. However, if you prefer a sweeter coffee taste, simply be careful at measuring out the amount of coffee creamer you put in your cup. The bottom line. Light to moderate caffeine intake seems to provide impressive health benefits in many people. On the other hand, very high dosages may lead to side effects that interfere with day-to-day living and might even cause serious health issues. Although responses vary from person to person, the effects of high intake demonstrate that more isn't necessarily better. To get the benefits of caffeine without undesirable effects, conduct an honest assessment of your sleep, energy levels and other factors that might be affected, and reduce your intake if needed. You should always speak with your doctor or health care professional before you start, stop, or change any prescribed part of your health care plan or treatment, and to determine what course of therapy is right for you. Caffeine is a stimulant found in various foods, drinks, and other products. According to the Mayo Clinic, the recommended amount of caffeine is up to 400 milligrams per day for healthy adults. Caffeine overdose may occur if you ingest more than this amount. Adolescents should limit themselves to no more than 100 milligrams of caffeine per day. Pregnant women should limit their daily intake to less than 200 milligrams of caffeine per day, since the effects of caffeine on the baby are not fully known. However, what constitutes a safe amount of caffeine differs for everyone based on age, weight, and overall health. The average half-life of caffeine in the blood ranges from 1.5 to 9.5 hours. This means it can take anywhere from 1.5 to 9.5 hours for the level of caffeine in your blood to drop to half of its original amount. This wide range in average half-life makes it difficult to know the exact amount of caffeine that can lead to overdose. It's commonly used to keep you awake and alert. Caffeine is technically a drug. Some of the most popular beverages such as coffee, tea, and soda, contain significant amounts of caffeine. A caffeine overdose occurs when you take in too much caffeine through drinks, foods, or medications. However, some people can ingest well above the daily recommended amount each day without issue. This isn't recommended because high caffeine doses can cause major health issues, including irregular heartbeat and seizures. Consuming high caffeine doses on a regular basis can also possibly lead to hormonal imbalances. If you rarely consume caffeine, your body may be especially sensitive to it, so avoid ingesting too much at one time. Even if you regularly consume large amounts of caffeine, you should stop when you feel any unpleasant symptoms. Several types of symptoms occur with this condition. Some symptoms may not immediately alert you that you've had too much caffeine because they may not seem serious. For example, you may experience dizziness, diarrhea, increased thirst, insomnia, headache, fever, irritability. Other symptoms are more severe and call for immediate medical treatment. These more serious symptoms of caffeine overdose include trouble breathing, vomiting, hallucinations, confusion, chest pain, irregular or fast heartbeat, uncontrollable muscle movements, convulsions. Babies can also suffer from caffeine overdose. This can happen when breast milk contains excessive amounts of caffeine. Some mild symptoms include nausea and muscles that continually tense and then relax. More serious signs of caffeine overdose can accompany these symptoms, including vomiting, rapid breathing, and shock. If you or a child under your care is experiencing these symptoms, seek a doctor's help immediately for diagnosis and treatment. If you suspect a caffeine overdose, let your doctor know of any caffeinated items you consumed prior to having symptoms. Your breathing rate, heartbeat, and blood pressure will also likely be monitored. Your temperature may be taken, and you may be given a urine or blood test to identify the drugs in your system. To prevent a caffeine overdose, avoid consuming excessive amounts of caffeine. In most cases, you shouldn't have more than 400 mg of caffeine per day, and even less if you're particularly sensitive to caffeine. Caffeine overdose can usually be treated without creating long-term health problems. But this condition can be deadly, especially for younger patients, such as infants and toddlers. Caffeine overdose can also worsen pre-existing health conditions, such as anxiety. A 2013 review has connected certain effects of excessive caffeine consumption with those of other drugs, such as amphetamines and cocaine. When treatment is given too late, there may be irreversible health problems and even death. You should at least consult your health care provider if you suspect a caffeine overdose. Thank you for watching. Please share your views and opinions on this topic in the comment box below. If you are new to my channel, please consider subscribing.